Welcome to New Hampshire's Business. I'm Fred Coker. There's evidence that New Hampshire's 10 community health centers are facing a financial and workforce crisis. And here is some of the evidence that's been developing over several years. Lamprey Health Care in Nashua, an example. They're in Newmarket and Raymond as well. Loss of about $1.4 million in 23. Lost that much in just 9 months in 24. Finances seem to be stabilizing now. That's by CEO Gregory White to New Hampshire Business Magazine. More than 40 New Hampshire healthcare organizations urge lawmakers to address workforce shortage in 24, including the New Hampshire Hospital Association, Medical Society, and New Hampshire Behavioral, let's say that, New Hampshire Behavioral Health Association, and the New Hampshire Public Health Association, and the New Hampshire Healthcare Workforce Coalition news release in January 24. Now, commentary by the president and CEO of Bi-State Primary Care Association in 24. She said New Hampshire's primary care infrastructure is at risk. That's Tess Stack. With me, and by the way, the proposed budget cuts to New Hampshire Human Service Programs in 25, that's this year. House Finance Committee, Department of HHS Budget, Health and Human Services, $160 million cut in human service programs. That's $48 million in Medicaid cut, 31.4 cut in families of developmentally disabled dependents. That's from the union leader. With me to walk through all of this, the CEOs of 2 New Hampshire community health centers, the president and CEO of Amoskeag Health in Manchester, Chris McCracken, and CEO of Midstate Health Center in Plymouth, Robert McLeod. Welcome to both of you.
Thank you.
Let me ask you first, I want to ask you about that proposed budget cuts in the House Finance Committee, $48 million cut in Medicaid. Chris, what's that going to do to your patients and your center?
It's going to be a huge barrier because we have about 35% of the federally qualified health centers' revenue income across the state of New Hampshire is from Medicaid. And as you can imagine, if you go to see a provider and you don't have insurance and they say, well, looks like you're going to need this test, looks like you're going to need to start this medication, what's the likelihood that you're going to have the finances to do that?
Right. Robert, same question.
Yes, I think it's going to be very difficult for us to continue to operate the way we're operating now, which is our health center has 15,000 patients, over 70,000 visits. 70% of all of our revenue comes from some sort of a federal level, so therefore it's going to be very difficult.
Yeah, most of your patients are low income, both of you. And many don't have health insurance, as you've said. They depend on Medicaid, as you said. There was an effort last year by your primary health care association to get the legislature to include uncompensated care fund. What happened to that?
I believe at this point that that's still in process. They're working closely to bring forward some legislation that would enable the federally qualified health centers and the mental health centers to have a resource for uncompensated care. The community health centers spent over $14.5 million in uncompensated care last year alone.
Wow. Bob?
Yes, same thing. I mean, our revenue is about $17 million a year, of which $1 million of that is uncompensated care.
Significant,
so
significant.
Yeah.
Now, workforce. I know it's one of the critical issues facing most of your centers, if not all of them, but it's so critical that more than 40 healthcare organizations in the state went to the legislature last year, as you know, to ask for help. Did they help? Did the legislature help? And what's the workforce situation this year? Chris?
I think the reality is there are a combination of issues, whether it's the lack of staff that are available in our community, the growing population that's needing services, and then the importance for us is keeping those student reimbursement programs like the SLRP fund available. It's our single greatest recruitment and retention factor for clinicians.
Clinicians. Bob, is that a need for you?
Yes, absolutely. In fact, most of my time at Midstate is trying to recruit and retain and do what we can, particularly fighting we're dealing with the market right now, which is very competitive.
We're going to have to leave it there. Robert McLeod, CEO of Midstate Healthcare in Plymouth, and Chris McCracken, President and CEO of MSK Health here in Manchester. All too short, but good information. If you missed part of this briefing, you can go to WMUR.com, where it will be posted all this week.